Hello, everyone. Welcome back to Health Unlocked, the power of salutogenesis with Jasen Petersen. Jason, how are you?
I'm doing pretty good. As we were just talking about, the crazy summer with all the camps and kids is coming to a close. This is the last week.
Yeah, yeah. And it's always fascinating that the different kind of camps you have.
Yes. Yeah.
Yeah.
This summer was really cool. There were a lot of really interesting camps for the kids, and we really kind of leaned into the performance base. So we actually had different, things for film, things for stage, and some of that is leaning into. We're going to try and have the kids develop and produce, I don't know, some type of show starting in the fall. Where hopefully they will kind of produce the entire thing. They'll shoot it. They'll have to market it, whatever. Put it on YouTube, however all that works. They'll have to figure it all out, and it'll be kids doing everything.
Wow, that's cool. That's super cool. It's like a real world entrepreneurship now.
Well, yeah. So this is taking the place of we were going to start a school, Aspire Academy, which was very much going to be a learner-driven, learner-governed school. It was actually an Acton Academy affiliate, and so if you're interested, you can look at what Acton Academies are. But the local municipality, whatever the local Jefferson County planning and zoning is. How do I put this delicately? Such a pain to work with that we sort of gave up, and Aspire Academy was going to have kind of an entrepreneurial bent to it, anyways, and so the idea was that kids, going through this school really was going to be a homeschool enrichment program. Over the years, they would, start multiple businesses. And, when they were younger, they were going to suck. And they were going to learn a lot. But each time they do it, it was going to get a little bit better, have a better idea, and so on and so forth. And the idea was that by the time they got to high school, or by the time they graduated high school, they were actually developing real businesses. And my goal was to give them, actually make them have to think about, well, do I go to college, or do I run this real business that I've developed? Or do I modify the business to a way where I can run it while I'm going to school and maybe take less of a load? Or do I sell it? And give them a way to actually fund college as well. Or that probably looks pretty good on getting into college applications and such. But that was the original goal. Now, instead of doing that with all sorts of random things, we're going to do it with a show. Okay, well, here's the thing. We'll put the structure. It's all there for you. You guys have to run everything and figure it out. And it's probably going to suck when it starts. And hopefully, after doing this for a while, it'll get to where it's actually fairly good. But if you've got young kids or young-ish kids and they're watching like the TV shows, they're terrible. And I mean, they're cheesy and it's just, I see my daughter watching some of the stuff. I'm like, yeah, why? But if you told me, oh, kids completely organized, produced, they did everything with the show. It's all about kids. If you see adults in the show, they went out and hired them. Then I would say, really? That's amazing. Not because the show got any better, but because it's actually being done by kids. I think that would be really cool.
Yeah, definitely something interesting. So I guess we'll keep an eye. Once it's ready, let me know too. You can check it out.
Okay.
And to our listeners as well, thankfully to our listeners, for the first time, we are in top 10 in the United States for alternative health. Today, I received this notification. So, and also I started to see a few people registering directly on the website to get notification for new episodes as it launches.
Okay.
It's always thank you to all our listeners. I also see our LinkedIn page have started to add few people, so that's great too. But yeah, reach out to wherever you can find it: LinkedIn, Apple, Spotify, the show's website, YouTube. You can find us everywhere. So that's where we.
I know we were a little light over the summer. But hopefully we'll kind of ramp back up here.
Exactly. Yeah. And today's topic is interesting because today we're talking different. You have coined a different term here, different model to say so. So let's introduce our listeners to what you are coining it as microimmune dynamics. And let's start first from what made you, I guess, evolve the terminology, and then we'll go further from there.
Yeah, I guess so. To back up, I guess it's clear that my because of or what makes it clear is my coining of the term cratogenic. In regards to conventional drugs, I'm not terribly averse to creating my own words, but I don't know. It's just when talking about local immune fatigue and local nutrient insufficiency or sufficiency, tissue resident immune cells, so on and so forth, the mitochondrial dysfunction, all of that stuff identifies where all of these problems lie, or where actually even that saying it that way is a pathogenic viewpoint, but where everything derives from. It really suggests that these are all independent issues rather than kind of the start of of a systems level breakdown. And describing fatigue of the tissue resident macrophages or immune cells without including the parenchymal cells. That's hard for me to say. So parenchymal cells are the functional tissue cells, and their mitochondria. That kind of leaves a critical gap. And now that listeners have heard me discuss this a bunch, all of the different connected components, and we've gone back and forth quite a bit, it's time to really now tie everything together. And microimmune dynamics captures the whole local ecosystem at play, right? And words have power, and this terminology kind of sets the stage so that we can discuss this without having to back up and define every single word that we're trying to say.
Yeah. No, I think you mentioned like it's like a unified term which helps reframe the entire healing model, right? So that's kind of
like, and I would call it a framework rather than a model, but okay, that's close.
Yeah. And how does the microimmune dynamics name help articulate its role in the health creation and set the stage for deeper exploration? Let's talk about that.
Well, okay. So giving the model or the framework a clear name, microimmune dynamics, does some key things for in regards to health creation, right? It first of all, it unifies these disparate elements under one banner. I guess before microimmune dynamics, we were talking about, again, all of these immune cells in isolation, terrain factors separately, and now every I guess we can call them stakeholder, from researchers to clinicians to patients, has this single phrase that signals kind of a holistic view of everything. Microimmune stands for, it's kind of on its own to convey both the local immune network and the surrounding tissue context, the cells, the extracellular matrix, and even the resident microbes. Dynamics obviously just underlies that this process is, or that this is a process with interconnected phases. It's not a static snapshot. The other thing that giving this name does is it kind of shifts the mindset from reaction to cultivation. And I guess it's been said before, names carry weight. So when we say microimmune dynamics, we move away from fighting pathology toward actively nurturing health, or at least that's my hope. Things that are controlling health. And health creation becomes a process of understanding and restoring terrain integrity rather than simply suppressing symptoms. We've kind of hit that topic over and over again. So calling it microimmune dynamics sets the stage for different protocols and products and research designed to bolster each element. But, the immune cells, the parenchymal cells, their mitochondria, the extracellular matrix, so that they all are working in concert. That's kind of the whole point with all of this.
So how would you, I guess, define it in simple terms, and what what components and interactions make up this whole concept?
Okay, so hopefully this will make sense in context to everything that we've discussed up to now. So microimmune refers to the local terrain, encompasses the tissue-resident immune cells, such as the macrophages and dendritic cells, that detect threats and then trigger cell danger response or healing cycle. Parenchymal cells, those again are the functional cells of an organ, and their mitochondria, more specifically their mitochondria, which actually adapts and adopts distinct metabolic profiles that define each phase of the cell danger response. You've got nutrient and ion levels, such as zinc and copper and other trace elements, that serve as the cofactors and enable progression. They actually physically enable progression through the healing cycle. You've got the extracellular matrix. That includes like structural proteins and growth factors and I guess even the mechanical signals that guide cell behavior. And as I mentioned before, resident microbes that modulate immune tone and local metabolism. So microimmune dynamics captures how all these elements work together in the local terrain to maintain health, adapt to stress, and drive efficient repair. Right. So again, I think of microimmune dynamics as a framework for understanding how local tissue ecosystems regulate cell function along a continuum, I suppose, from optimal repair to chronic dysfunction. And it doesn't, I'm not trying to replace Navio's cell danger response or even Lintern's cell suppression theory. Rather, it maps the factors that govern healing cycle progression, showing how nutrient imbalances slow progress, deeper deficits in those in that nutrient sufficiency leads to senescent cell accumulation, and then how severe shortages promote, I guess, microbial takeover or CDR persistence. And so by examining nutrient availability, mitochondrial function, and I guess the behavior of the tissue-resident immune and parenchymal cells, and the health, I guess I should also include the lymphatic and neuroimmune pathways. Microimmune dynamics really reveals the graded bottlenecks that determine whether cells move smoothly through cellular healing or become progressively trapped in dysfunction. And remember, that is kind of everything. That's everything that we've talked about up to date.
Yeah. So really, it's not just a snapshot, right? It's a whole process. It's a whole process, and showing, and that's why it's probably the dynamics word makes sense here too. So that's what it is. Okay. And in what ways does microimmune dynamics differ from the conventional medical or functional medicine approaches to immunity and inflammation? Can you highlight some statements or examples for contrast here?
Sure. So it kind of shifts the focus from systemic level interventions to what's happening in the local ecosystem, where immunity and tissue function really intersect, right? So microimmune restoration is the practical application of this framework, encompassing corrective actions aimed at reversing local immune exhaustion and associated nutrient insufficiency. But if you want to contrast some of the approaches, look at conventional medicine first. So we can look at all of these in terms of testing, treatment, and risk. That's probably a good way to look at them. So in terms of testing, conventional medicine relies on blood markers and organ function tests and symptom relief with drugs, such as like corticosteroids or biologics. And I guess that blends into the treatment. The idea with treatment is to treat inflammation and immune dysfunction and systemic problems that need to be suppressed. and that obviously carries the highest risk. Integrate, and that, again, even this is a continuum, right? There's not purely conventional medicine and purely salutogenic medicine and purely integrative medicine. There's a blend at the edges of everything, right? So integrative medicine, if we look at the testing, they're looking for root causes by testing for like gut dysbiosis and nutrient deficiencies and toxin exposures. The treatment there, they use elimination diets or targeted supplements, microbiome therapies to try and rebalance the whole body systems. And in terms of risk, well, integrative medicine's much better, much safer than conventional medicine, but it still involves systemic testing and interventions. So they're trying to treat everything systemically, which may no longer be sufficient to resolve the microimmune exhaustion and or collapse, as we've talked about before. So now when we talk about microimmune restoration, so testing from a microimmune dynamics perspective is really, if you've got chronic symptoms, you've already passed go here. There's no need for more diagnostics. You just proceed directly to the salutogenic intervention, collect your $200 on the way out, and get started. That's a Monopoly reference, if you care. As far as treatments, so we just apply restoration levers such as nutrition, breath work, movement, targeted essential ion application immediately whenever chronic signs appear. And providing this that intrinsic cue that CDR progression can go from initiation through reintegration. In terms of risk, that's obviously the minimum amount of risk, and there's almost no risk of toxicity to the body because of the body's ability to buffer any of these essential or excess essential ions. But notice, even in the microimmune restoration, I mentioned some things that you'd probably like, diet and nutrition and such. Many people would want to put that into the integrative medicine category. So there's a blend here for sure. I guess really my point, and I apologize if I got off topic there. I really want to see that we can reverse sort of the order of operations. Unfortunately, the typical kind of sequence of interventions is conventional first, then integrative, then alternative if nothing else works. And I guess for now, microimmune restoration would be considered alternative. I'd argue that a microimmune restoration first sequence is better in almost every way. So if we could start with that, and just keep it simple, even if you just apply eyeball products and or other restoration inputs immediately wherever you've got chronic symptoms, you don't really have to go through extensive diagnostics. If the symptoms resolve, maintain a healthy salutogenic lifestyle, and you're probably pretty good. Then move to integrative care if it's needed, and really only if the what you were trying for the microimmune restoration failed, should you then, or do you then need to start assessing systemic factors, where they're going to use blood panels and then elimination diets and then targeted supplements and all that kind of stuff to correct any remaining deficiencies. In the end, I see this as coming down to the same thing. It's just now we need a little bit more granularity to make sure that we're targeting the absolute right things within the microimmune layer. And then if that still doesn't work, okay, reserve, I guess, conventional medicine for the last resort. So both of those previous attempts fall short. Now introduce your whatever, immunosuppressants or biologics. And but I would also argue that you really only need to use those when you need rapid suppression, right? When that's essential due to, their higher risk, right? So if you've got something that is really, really urgent, okay, fine. go ahead and use some salutogenic therapy to I was going to say correct, to rectify that real quickly, but only if you really have to do it really quickly. Because you don't have to do it really quickly. If you've got time, you really should try the other paths first, because I would argue that in the end, they're going to work better. Now, it's possible that they don't work. Okay, fine, set that aside. But if they're going to work, they're going to work better, and they're not going to cause as many other problems.
Well,
So what'd you ask? Do you want a specific example?
I was going to ask before this that the order thing makes sense, but wouldn't the criticality of the condition defines that order? Like say, what I mean is like if somebody is critically ill, right, and there is this certain type of, I don't know, I'm just making this up, any type of cancer, for example. If you are way at stage 4 or something, then you would almost feel compelled to go conventional route because uh, I guess the question is that a marker also or filter for that order?
Cancer, I wouldn't. Well, I don't know. I would actually argue that cancer isn't. It's not normally an urgent matter because it's taken a long time to develop, and unless it's going to kill you tomorrow, it's okay as long as you're getting better every day. It's okay that it takes a while to get better. But I would actually prefer to reference this in like acute, right? You break your arm. Well, okay, we're not going to fix a broken arm, right? Acute damage by, putting on some of that ion gel onto it. That might be great and help and wonderful. It's not going to set the bone. If you've got a big, huge gash, it's not going to pull the tissue back together and stitch it up. Now, if it's a gash that's not healing, okay, well, it might fix that. But it's also not going to do that overnight. And so, if you're bleeding out, well, okay, then we need cratogenic therapies to fix that immediately right now. Otherwise, you're going to die. That's not really what I was talking about. And there is a little bit of confusion here, right? Because some of the assumptions that we're making is that, oh, you're already at chronic disease. Well, if you're already at chronic disease, this microimmune dynamics has been getting messed up for a fairly long time. And you've been within that microimmune fatigue cycle, which I might describe a little bit later, for a fairly long time. But I guess I'll also, let's see if I can agree with you in terms of if you're in later stage cancer. So cancer specific in that I'm going to say that you remember, I believe that everybody is treating cancer incorrectly in the first place. So they're forcing the cells to do all sorts of things that they think need to happen, but they're doing it in a way either at the wrong times or in a way that's also damaging lots of other cells. And that's not really setting you up for success. Now, let's just make something up. Assume that you've had cancer for a long time, and now within the cancer cells or near that, certain cellular functions are actually starting to fail because they've been in CDR2 for too long. In that case, I'm not sure that I would say I wouldn't argue, but I wouldn't argue too much that you take a cratogenic drug to fix that problem that has now occurred that we also know needs to be fixed. And because that might need to be fixed quickly, otherwise everything will fall apart. But again, I would still say if you back up and say, okay, well, what caused that in the first place? And if it is the intracellular fungal infections and or microbial component that is triggering an overwhelming cellular signaling such that the cells are stuck at a tissue level, meaning lots of them in CDR2, well, that's the real cause. Get rid of that, and the cells should move on through the healing cycle the way that they're expected to. And, you got to do a few other things such as reduce oxidative stress, be able to reset the redox signaling pathways, so on and so forth. But, and to be honest, that happens pretty quickly. But that's not to say that you might have other situations where, because of how long you've been in this state, it's caused other issues, and those other issues are now really urgent. Did that make sense?
Yeah, that makes sense. Yeah. Okay. And how about an example for
Okay.
specific example, so we can just get more clarity there.
All right. So I actually wanted to consider prostatitis as an example. So chronic bacterial prostatitis is driven by like biofilm protected bacteria in the prostate. It's almost like sponge-like tissue. And so bacteria can get inside of that. Once it's covered with a biofilm, it's really hard for immune cells and or even drugs to get to clean it out. Plus, if you've ever tried to clean out the inside of a sponge, well, that's kind of difficult. And then over time, that bacteria, if it stays in there for a long time, it can start to calcify and it becomes hard. And then that causes all sorts of problems. So what does conventional medicine do? You've got long courses of antibiotics to try and clear the infection. Then you've got like alpha blockers to treat the urinary symptoms, and then NSAIDs for pain control. All of that isn't really targeting the initial problem. And we know that, I mean, I guess the antibiotics might be, but again, remember, now you're trying to treat a local infection systemically, and that can be tough. Integrative medicine tries to, use other things that like whatever, saw palmetto and quercetin and what else? Bromelain supplements and various things like that. Do different pelvic floor physiotherapy and biofeedback stuff, and then elimination diets and maybe even oral probiotics and stuff. It's less cratogenic-ish, but still you're trying to treat a very localized problem systemically. And if we look at the microimmune restoration first paradigm, you've got, I'm actually just going to jump straight to topical eyeball application over like the perineum, which is, right above the prostate. That's probably one of the best things you can do. So now you get restoration of the zinc and copper and other trace elements directly at the site. You get the broad antimicrobial action that can disrupt the biofilm and also eliminates that trapped bacteria. You've also got this kind of signal-driven healing that's occurring. The restoration of the iron milieu advances the stalled CDR phases in progression without pre-treatment diagnostics or even invasive therapies, right? So, I mean, this is easy. You just take this stuff, wipe it on, and it might do everything that you need. Then I would follow with symptom-guided follow-up, right? If pain or urinary issues start to resolve, you don't really need further intervention. And if it's only a partial response, well, then add integrative support before you jump straight to antibiotics, because I think that eyeball is going to be better than antibiotics anyways. But I don't know that I'm allowed to say that yet. But so again, by leading with this microimmune restoration, especially in this case with an eyeball-based product, you can address the core nutrient and signaling deficits first. Integrative and conventional therapies become second and third line measures only if your salutogenic intervention doesn't fully resolve symptoms.
And when someone's is like terrain is off balance, what real world signs will emerge beyond what shows up on the lab reports? How could a listener spot early indicators?
Okay, so real quickly, this is probably where I should get the terminology or the rest of the terminology that I'm making up defined. So I call this the microimmune fatigue cycle. So remember, in the past, I used to kind of call this local immune fatigue. It's not a definitive thing. This kind of happens in stages or a continuum. So it consists of kind of three separate stages. The first I just call microimmune initiation. That's the normal transient drop in local nutrients as tissues shift into their inflammatory response. Cofactors briefly run low because of demand and then recover once supply catches up. That's normal. That's supposed to happen every time cells go into CDR. And actually, the recovery is, I'll say it this way for now. I might take it back later, but the recovery of those nutrients is almost a signal in and of itself that the local the local ecosystem is ready for transition. The next step is what I call microimmune exhaustion. This occurs when stressors either repeat or persist, and your local nutrient deficits start to deepen, iron accumulates, oxidative stress starts to rise, and I guess I'll say chronic oxidative stress starts to rise. Cells begin to stall in their healing phases, and all of this starts to increase senescence markers, or the creation, got it? Or the creation of senescent cells, really aging, right? We talked about that. Then the next step I would call microimmune collapse. And that represents true chronic pathology, I guess. It's where a critical mass of cells has become CDR persistent, tissue wide, right? With where healing stalls, and chronic disease has kind of started to take hold, or has taken hold. At this point, restoration of local nutrients via systemic means becomes very difficult and problematic to do. And that's most of what I've talked about before. Whereas when we talk about chronic disease, I've jumped all the way to microimmune collapse. Okay, well, in chronic disease, it's really hard to correct the nutrient imbalance systemically because the demand outstrips our ability to supply systemically. So you asked for early cues or clues of what that might mean. So I guess when it's strained or starting to enter microimmune exhaustion, I guess often you get patterns that appear day to day, such as I guess persistent low-grade inflammation, whether that's whatever minor joint or muscle stiffness that kind of lingers beyond what normal recovery should be, occasional skin redness or itchiness or mild swelling after your normal routine activities. Delayed tissue repair, cuts, scrapes, bruises, and stuff take noticeably longer to heal, and you frequent blisters that resolve slowly or something. Now, obviously, there can be other reasons for these things as well, right? So you kind of want to look more for a bunch of things occurring rather than, oh, I got that one symptom that I'm coming down with cancer now, so let's stay away from that. I guess you could get the subclinical infections, so recurring sinus infections and a mild cough without a clear cold or allergy triggers or something like that. Periodic yeast or bacterial overgrowth in the gut or on the skin, energy recovery issues, unexplained fatigue, digestive issues such as bloating or gas or stool irregularity. That kind of comes and goes and you don't really know why, and could also be mild discomfort after foods that are, I guess, known to support immune health, such as like a high zinc or probiotic rich meal. I'd even shift into mood and cognitive kind of hints at what might be going on. So like brief episodes of brain fog, poor focus. Now, under minimal stress. Now, obviously, if you're really stressed, well, then lots of these things would be normal reactions. And low-level irritability or anxiety that doesn't resolve with your typical relaxation practices, whatever you do to relax. And I guess how do you spot these early indicators? That would be a good thing to know. I guess keep like a simple health journal, noting any recurring aches or slow healing or energy dips and stuff like that. Compare your recovery times. If your usual kind of post-workout soreness is extended by days, it might signal local terrain fatigue. Track your skin or mucosal irritations. That often kind of reveals the terrain imbalance first. And notice shifts in mood. But just kind of summarize all that, right? If your workouts take longer to recover from, and your skin's kind of being a diva about healing, then yeah, you might that might be your terrain kind of waving a white flag, asking for help. And all of those everyday signals usually show up long before anything shifts on a lab report. Now, getting labs done might be great, but anything that's going to register is significantly past that, because remember, most labs are systemic. And so you're going to have a local issue for a long time before that starts really affecting you systemically.
This is where I guess that point comes into play, that a lot of treatment, even in integrative medicine, starts with do the lab first, not the symptoms. And then you might not see the number per se, and you'll say, fine for now, right? And that's why it makes all the more sense how what you're saying is to probably look at these things as it's happening versus how even integrative medicine looks at it, right? So
yeah, but we're not really trained to look there, right? Now, and absolutely, I do it myself, right? My wife and I, we're I think it's Function Health, where we can go out and get, a crazy blood, and tissue and urine and all sorts of stuff, hair analysis, so they look at all sorts of things a couple times a year so that we can really track what's happening over time. But even then, all of those things, now, while that's way better than, oh, well, now I'm sick. Okay, let me go get my blood work to find out what's wrong. So it's better than that, getting my blood work to say, oh, well, these things might go wrong at some point unless you start to correct them. But even then, the blood work won't start showing this until quite a ways into things already, right? And so what I'm trying to suggest is that we start even earlier than that, but that's going to be, on one hand, much less clear. Well, I was tired today. Is that a big deal? Well, I don't know. Not really. What was going on yesterday? What's going on today? How stressed are you? Now, if you say, well, nothing, everything should be fine. Okay, maybe you're just coming down with a cold. It's not a big deal. But, if you're like, 5 of every 7 days, well, that might be when you're working. Much of the time, you're always saying, oh, I'm always tired these days. Well, okay, that might be a clearer clue. Or, well, suddenly now every time I go out and play volleyball, my knees hurt. They didn't used to before. Okay, well, maybe I should look into that. Might not be a big deal. Might just be that I'm trying harder. Or it could be that, at least at those mechanical locations, things are starting to break down a little bit, and I need to be doing something to support it better than I am.
Yeah. And, well, I guess you described the terrain depletion as distinct from the classical immunocompromise. So what does terrain depleted look like on a cellular and systemic level, and why is that distinction important?
Okay, so now we're looking more cellular. So cellular signs of immune exhaustion are, so you get sort of the mitochondrial rigidity. So mitochondria, they remained more they remain more fragmented. Remember the M1, M0, M2 phenotypes? They remain more fragmented in M1 or M1-like state and fail to, if we want to call that, hyperfuse all the way to kind of that idealized M2 state. Or at least they exhibit metabolic inflexibility there, limiting both energy production and redox signaling. So that's specifically why you might feel like you don't have as much energy, because your mitochondria are physically not fusing as well as they should be. You've also got nutrient dysregulation that starts to occur. Remember, that's local shortages of zinc and copper and other essential cofactors that can impair kind of critical enzyme systems. And then you start getting excess iron or imbalanced minerals, and that further disrupts the redox balance and promotes oxidative stress. We've talked about all this stuff a little bit before, but remember, this can be in a continuum. So it's not like all of a sudden, oh, there's not enough zinc and copper. It's just not enough or zinc, copper, and even magnesium to really fuse the mitochondria together well. But it's enough to get you out of the cell danger response, so that it gets you out of the healing cycle. It's just not as good as you did last time. And then the next time you do it, it's not as good as the time you did before then, and so on and so forth. So there you start getting the stalled healing cycle progression. Remember, cells start to linger in that inflammatory or proliferative phases without moving toward integration. And that ends up being kind of evident as persistent DAMP. Remember, damage-associated molecular patterns, or PAMP, pathogen-associated molecular patterns, those signals that are kind of in the tissue. And you start getting impaired repair function, slowed membrane resealing and reduced extracellular matrix synthesis, and weakened, how would you say that, phagocytic clearance by immune cells. And even then, more than that, you get the immune cells end up not clearing the senescent cells as well or as fast as they should. So then what are systemic signs of that? So that's kind of what we discussed in what you just asked before, the question before this. So systemic signs of this microimmune exhaustion would be kind of the low-grade chronic inflammation. And if you're doing blood tests or something, mild elevations in the C-reactive proteins or interleukin levels without an acute infection to explain that. Metabolic inflexibility, which was that the last episode that we talked about metabolic inflexibility? So where you start to shift to a reliance on glucose over fat oxidation at rest, and kind of an inability to switch between fuel sources efficiently. Because remember, if the cells, or if the mitochondria don't need to get all the way to that idealized M2 state, they won't. And then the fact they're not reinforces that you can't digest fat as well, and then therefore they won't even more, and you get into that vicious cycle. So why does this matter? You ask why the distinction matters here. So this kind of allows us to align therapy better with biology, recognizing that terrain depletion directs treatment toward local nutrient and cofactor resolution rather than kind of direct immune either stimulation or suppression. It reveals the true deficiencies. And what looks like immunocompromise often is really just a reversible lack of vitamins and minerals. Supplementing those cofactors then re-empowers both the immune and the tissue cells. And this will avoid unnecessary cratogenic drugs, which I think is a big one. And by treating depletion as immunocompromise, it can lead to the overuse of antibiotics or biologics. And restoring the microimmune environment first often resolves the chronic signs, without even getting to those high-risk interventions. You don't need them. So really, in that microimmune fatigue cycle, the core problem is a local ecosystem starved of nutrients and signals. Those are almost the same, needed to properly progress through the healing cycles. And once you restore that balance, both immune and tissue cells can resume their normal healing sequence, and everything starts to work better.
How should?
The way that it should.
Yeah. So how should practitioners or individuals, for that matter, rethink these treatments through a microimmune dynamics perspective? Like, what needs to happen?
So I guess from a microimmune dynamics viewpoint, right? Every intervention should be evaluated first on its impact on the local microimmune ecosystem. So that means recognize collateral damage. So sure, antibiotics kill the bad guys. When they can kill the bad guys, they kill the bad guys. But they also blow up the neighborhood. It's kind of like, calling in RoboCop for a noise complaint. A little bit overkill. And so they might clear the pathogens, but they also then disturb the resident microbes that support immune tone, redox balance, and nutrient cycling. And the overuse of, say, antimicrobials can leave the terrain depleted and stall healing all by themselves. So that's the first one. Recognize collateral damage. The next I would say is use targeted approaches. So if we stay on the antimicrobial idea here, reserve potent antimicrobials for cases of clear cases of infection. And when possible, choose either narrow spectrum agents or local delivery, for example, eyeball or topical antiseptics, to minimize ecosystem disruption. And just a quick point on that. Remember, eyeball, on one hand, it's highly antimicrobial, so it'll wipe out pretty much all the microbes, but it doesn't linger. It's really fast. It does that really fast, and then it's gone. All of the ions get used up, and now are starting to be used nutritionally in the cells, and that allows the whatever microbiome we're talking about, wherever your local ecosystem is, to repopulate with what should be there. At least hopefully that's what happens. The next thing I guess I would say is to pair whatever you're doing with immediate restoration. So, again, to stay with the microbials, if you do have to employ some antibiotic or something, follow it kind of at once with the microimmune restoration inputs. So that's the whatever trace element replenishment or matrix support to rebuild the microbial balance and or mitochondrial function there. Look at timing. So if you know that a terrain is stalled in inflammation, so CDR1, waiting too long to restore those nutrients can reinforce that phase. So I would say introduce salutogenic restoration inputs early, ideally alongside or immediately after your antibiotic use. Monitor functional outcomes because that's what we really care about. And so rather than relying solely on like culture results or symptoms checklists and stuff, watch for real world tissue responses such as repair speed and inflammation resolution and energy rebound to gauge when the terrain really has rebalanced well. And then, I guess this is a long-term thing, but cultivate resilience. And I think one of the very first episodes, maybe the second episode, that we talked about resilience a lot. And so over the long term, you want to reinforce that terrain health with lifestyle levers, nutrition, movement, sun exposure, breath work, and all that kind of stuff. So truly the salutogenic factors, so that interventions become less necessary and the risk of the terrain disruption declines. So I guess staying with the antibiotics, if we can reframe them as tools rather than cures and always kind of couple them with immediate terrain resolution, microimmune dynamics really turns kind of potential disruptions into, I guess I'd say, opportunities to strengthen the local ecosystem and drive lasting healing and health.
And with all this, where does the ion biotechnology and specifically eyeball fit into the microimmune dynamics framework beyond being just a product? How does it function as a terrain restoration method or strategy?
Yeah, so this is really kind of where the rubber hits the road in terms of all this. So ion biotechnology really is the study of microimmune dynamics. And I guess remember that eyeball is much closer to a supplement than a drug, although really neither. It, at this point, serves as the flagship microimmune restoration strategy within the microimmune dynamics framework. It goes kind of well beyond just being a product. It acts simultaneously as both the nutrient supplier, a biofilm disruptor, and the the healing cycle progression enabler. So you've got direct local nutrient restoration. Eyeball delivers zinc, copper, and other essential trace elements exactly where they're needed. And that replenishment, I guess it corrects the core deficit of microimmune fatigue, exhaustion, or collapse, and provides the intrinsic signal that allows mitochondria to and immune cells to move naturally through inflammation, proliferation, and reintegration. So it's really enabling CDR progression. Eyeball restores the local zinc and copper, and even magnesium, so that mitochondria in both the parenchymal and tissue-resident immune cells have the cofactors required to shift from M1 through M0 to M2 phenotypes. And because, you need to understand, without those nutrients, mitochondria cannot fuse or change metabolism, and the healing cycle stalls. So those cofactors are physically needed in the different enzymes to really start stitching the mitochondria back together, so it fuses back together. Let's see. So then I guess the other point is biofilm and pathogen disruption. So Eyeball's ionic action breaks down microbial biofilms. We've proven that. In whatever, calcified pores and tissue crevices, and it clears hidden infections pretty well. It is transient, but broad spectrum, and its effect then kind of gives way to nutrient-driven repopulation of a healthier microbiome, right? Because even so, again, it's nothing is black and white. As it goes in, the concentrations are way too high, destroys any pathogens, gets used up by cells, starts to pass on. As the concentrations start to drop, well, at some point, now it's actually fairly low, but at some point, they then start to feed and be nutritious to everything, including some microbes. So that actually does help the microbes come back and repopulate, hopefully the way that it should. And if it doesn't, you just do it again, over and over again, until we've gotten everything kind of all taken care of. So really, you've got this multi-layered ecosystem support. The immune cells regain coordination and full CDR responsiveness. Parenchymal cells and their mitochondria recover metabolic flexibility. Obviously, some of that's going to have to do with your diet as well. You need to start eating more fat. Lymphatic pathways even improve flow as endothelial and smooth muscle cells start regaining the contractility. I don't know how to say that word. Contractility. Their ability to contract in and out. And even the neuroimmune circuits kind of calm down as the peripheral glial cells or glia cells and nerve endings kind of stabilize their ion gradients. All of this is part of the microimmune terrain. And remember that the cells don't progress through the CDR or healing cycle until the terrain is sufficient. So that means you've got to have nutrient sufficiency. Zinc, copper, magnesium levels need to be restored. You have to have redox normalization, so balanced NAD pH and NAD P positive or P plus and glutathione cycling. That needs to be balanced. ATP sufficiency via oxphos without kind of the glycolytic overdrive. An absence of your DAMPs and PAMPs, and then the cytokine shift towards kind of pro-repair tone instead of pro-inflammation. So, in sum, Eyeball kind of exemplifies how ion biotechnology operationalizes microimmune restoration. It corrects the elemental deficits that stall healing. It resets the cellular signaling and communication needed for coordinated CDR progression, and it resets the entire microimmune terrain in a single safe intervention.
So if it's doesn't it feel like it's kind of like hard to believe it does so many things? So, and
Well, yeah, absolutely, and that's why I spent over 5 years just looking at what its mechanisms of action could be, working backwards from we're seeing all of these effects. So to make that clear, we're not going the other direction. I'm not saying, oh, this is what's wrong. I think I could figure out how to fix it. We actually were exposed to something that was fixing these things. And so functionality was getting better. And so we had to turn around and say, okay, well, how is that possible? And why? Why would that be happening across such a large range of things? From I'm not as sore as much after exercising to people are, how do I say this without getting in trouble? People are using it and getting good results who have chronic disease and, using it when when kids have pink eye and having that disappear in a couple days to aging better. How is all of this happening at the same time? And it really just comes down to mineral sufficiency, which is a big thing.
well, thanks for sharing all the things. But before we conclude today's conversation, I guess any last words for our listeners that you want to specifically talk, concluding
Yeah.
statement?
Yeah. So I actually want to back up just a little bit because we were getting, fairly technical with lots of different things here. And I'm afraid that we might, the way that we're presenting that might be missing the forest for the trees. So I guess I'll end with microimmune dynamics is really the foundation of salutogenesis. It exposes the cellular processes that initiate disease, recovery, and even aging. By detailing how the local nutrient balance, mitochondrial function, and local immune coordination all interact, it shows why chronic stressors stall healing cycles and drive senescent cell buildup. At the same time, it explains how nightly recovery either strengthens or further depletes our resilience. And as the root of salutogenics, microimmune dynamics should be our guide for both targeted treatments like eyeball and everyday salutogenic practices, of which eyeball can also be a part. These practices that restore and maintain our microimmune quality and, in the end, maximize health there. So I want to point out microimmune dynamics isn't a theory, it's a map. And I'm not trying to compete with anybody else's theory. And but this map, I wish it existed before all the people that I loved got sick and stuck in systems that had little to no answers.
Yeah. All right. Well, thanks again, Jason, for bringing, I would say, a better understanding of this thing with ever expanding area that we are trying to explore and spread knowledge about. So this goes a level up today. In today's episode, we're taking it to the next level of how to expand this concept so more people can understand it even better. So I'm sure this is not the last one. We'll keep honing on expanding this knowledge as we go. But I think this is a good, like you said, a framework here that's been discussed here today, microimmune dynamics, and we will need to expand on it from here on. So once again, thanks for your time. Appreciate all the knowledge that you shared. Another knowledge filled episode, and we will be back next time. Thank you.
All right. Thank you.